Commissioner Wambrew and I are pleased to be able to join you all this to provide an update on where we stand with respect to COVID-19 for the entire state of Maine for today, Thursday, March 11th, 2021. Right now in Maine, there are a total of 46,441 cases of COVID-19, an increase of 187 cases since yesterday. Of those cases, 36,221 are confirmed, 10,220 are probable cases. Cumulatively, over the past year, 1,585 people have been hospitalized. And right now in the state, 70 people are in the hospital. 23 of them are in the critical care unit with COVID-19, and 9 of them are on a ventilator. Overall, 723 people have died with COVID-19. Turning to testing for just a moment, our 7-day PCR positivity rate now stands at 1.52% across the entire state. And our PCR testing volume is at 592 tests for every 100,000 people. Similarly, our antigen positivity rate now stands at 4.25%, with a volume for antigen tests of 137 for every 100,000 residents in Maine. Next, a few updates on where we stand with respect to vaccinations and vaccines. Let's start with vaccinations. Cumulatively, Maine has now delivered 463,877 vaccine doses of COVID-19. Of those, 293,566 are first doses, and 170,311 are second doses. Maine has been working to increase the shots per arm that we deliver every single day. Indeed, yesterday alone, we set a record for the number of doses that we administered across the state, 17,651, a new high mark for us. Over a 7-day period, Maine is delivering approximately 12,612 doses every day on a 7-day basis. We've got more work to do to expand that number, but we are trending in the right direction. And finally, we received our final doses that Maine has been allocated by the federal government for vaccines that will be delivered to our state next week. Overall, there are 34,020 doses of vaccine that will be delivered to the state for our allocation. Of those, 18,720 are doses of Pfizer vaccine, and 13,700 are doses of Moderna vaccine. A few hours ago, we learned that we would also be receiving a small allocation of Johnson & Johnson vaccine, 1,600 doses to be exact. Those sum to that 34,020 number that I mentioned a moment ago. But I think it's important to put that number in perspective. Overall, across the state, that is only 520 doses more than we received last week. Now, we're thankful to have additional doses, and we understand that later in the month or in the month of April, the nationwide supply will increase, perhaps even significantly. But for right now, and for the week ahead of us, Maine will be only receiving 520 more doses next week than we received this week. There are other channels of allocation, places that will be receiving vaccine directly from the government, separate and apart from the allocation that comes directly to the state of Maine. Those are places like retail pharmacies, as well as increasingly federally qualified health centers. We usually learn about what those facilities will be receiving a few days from now. But as to what the state of Maine will be receiving for our allocation and distribution, it's about 520 more doses next week than this week. We hope that in the coming weeks, that number goes up from 520 new doses to several fold more. But for now, we will do the best we can with the doses that are being allocated and work in a manner to allocate them fairly and equitably across the entire state. Finally, I'd like to take a moment to step back and think about where we are as a state. Tomorrow marks 1 year since the first case of COVID-19 was confirmed in Maine. 1 year since we all began this long day's journey into night. 1 year during which the unfathomable became the commonplace with, frankly, unnerving frequency. I'd like to take a moment to discuss the year that was, and in particular do so with some numbers that, for me, tell the story of COVID-19 up to now. Numbers that show not just the impact of COVID-19, but also the collaboration, the teamwork, the camaraderie that has been generated by our response. It truly takes a number of different actors coming together to mount the response that we've displayed. And I think some of these numbers will help tell that story. Now, some numbers tell us where we are, some numbers tell us where we've been, and others tell us where we might be going. Today, I've got a selection that I think do all three. The first number is 723. That's the number of Maine people who have died with COVID-19 in the past year. That number is notable for what it tells us as well as what it doesn't tell us. It tells us that over the past year, nearly 2 people died every single day in Maine with COVID-19. That alone speaks to the toll that COVID-19 has taken across Maine. But that number is notable for what it doesn't capture. And that's the thing with numbers. Metrics matter, but not everything that matters can be measured.
Special report. Here's
that
Lester
number,
Holt.
723
Good day, everyone. We're coming
dead,
on the air with breaking news. President
can't
Biden
even begin to capture the sorrow, the grief, the loss that 723 families in Maine have experienced over the past year. Worse yet, what that number doesn't even begin to convey is how the process of dying itself has changed during COVID. Because of COVID and the various restrictions that healthcare facilities have imposed, dying has become, for many Mainers, a solitary affair. And as a result, many families have been deprived of the opportunity to be with those that they loved in their final days. Even harder is the fact that the process of experiencing grief, a process that is made already difficult, but can be made easier by being able to share it. That process of grieving collectively as families and in groups, that's been something that many Maine families have not been able to do because of COVID, and something that that number, 723, doesn't even begin to capture. Now, again, some numbers where we've been. The second number that helps us understand that is 320,000. 320,000 is the number of COVID-19 tests that the Maine CDC's Health and Environmental Testing Laboratory, in partnership with our colleagues at IDEX Laboratories, have conducted over the past year. Now, that is an equivalent to a 10-fold increase in the workload. And in order to accomplish this monumental task, the staffing levels at the laboratory more than tripled. Now, that number is a companion to another number, 1,967,728. That's the number of all COVID tests that were performed overall for Maine folks across the state since the very earliest days of the pandemic. Those numbers in tandem show just how many people have been tested for COVID, as well as have had to endure some of the anxiety that comes with being tested for COVID. It's not just about testing, though. It's also about prevention. And that's why the fourth number is important. The fourth number is 4,648,080. That's the total number of pieces of PPE that have been shipped since the beginning of the pandemic. I want to put that number in perspective. That amounts to more than 3 pieces of PPE for every single person in Maine. Now, to be sure, Maine CDC began distributing PPE well before we had our first confirmed case on March 12th of 2020. And that's because we wanted to keep healthcare providers.
$2 trillion COVID relief package. She's going to be going to Pennsylvania and Georgia with the vice president a little bit later on next week. But the question becomes, can he fulfill that promise of trying to unify this country? That was a key campaign promise, Lester, as you know, and this piece of legislation passed without any Republican support. Republican lawmakers saying that the price tag was too high, that the legislation was not targeted enough, and that ultimately it would only add to the deficit. So the question becomes, how does President Biden move forward and try to fulfill that promise of bipartisanship? What legislation will he aim to take up next? We'll look to see if we get any answers about that when he addresses the nation a little bit later on this evening. Lester?
PPE, the testing supplies, to facilities across the state. In addition to that, PPE doesn't do any good. It doesn't protect healthcare providers unless they've used it properly or are using it properly. And that's two is why the next number is critical. That next number is 4. Now, the next set of numbers show just how far-ranging the impact of COVID-19 has been and how diverse and collaborative our response to COVID-19 has been. Here's what I mean. The pandemic has been marked by scarcity, whether of PPE or of testing. But there are other types of scarcity that have been brought into view by the pandemic. Throughout COVID-19, so many Maine people have struggled with the scarcity of basic necessities like food, healthcare, and even friends. All of us have endured, but some have endured more than others. Elderly Mainers, for example, were affected in significant ways. In addition to suffering the majority of deaths in our state, they struggled with things that many of us might take for granted, like their next meal. That's why the next number is really illustrative. That number is 1,056,258. That's the number of meals that were delivered to older adults and adults with disabilities who were sheltering in their homes throughout the year of 2020 by area agencies on aging, their community partners, and in partnership with Maine's Office of Aging and Disability Services. 1,056,258. That's triple the number of home delivered meals in an average year. But it's not just the elderly who struggled over the past year. Across Maine, the pandemic deepened cracks that had already existed. But for every person who was down on their luck, there was someone to lend a hand. For every scared person, there was someone who was willing to console them. And for every group out there, they were doing something to help. From dentists who were delivering unused PPE during their off hours, to businesses and manufacturers across the state who converted from making boots to making masks. Maine came together at its core rather than coming apart at the seams. Now, some of the problems that we experienced during COVID are long-standing, and the pandemic brought them into focus. But we were there to help. Maine's Office of Family Independence significantly improved access to benefits for low-income families. That includes immediately and seamlessly modifying their systems to allow more people to access Maine Care coverage, starting in March of 2020. This allowed them to maintain their access to healthcare throughout the COVID-19 crisis. We also found creative ways to keep access to these social and healthcare services going. That's why the next number is important, 900. 900 represents a 900-fold increase in telehealth utilization by Maine Care members over the past year. Indeed, Maine Care has led all the state Medicaid programs nationally with respect to children's access to telehealth services throughout the pandemic. What we found throughout the pandemic was that there were many who needed help, but for every child, for every person, every parent, there was a community that was willing to help them. But nevertheless, the pandemic made several underlying factors all too common. For example, anxiety and fear have permeated and punctuated the pandemic, especially for those who have been exposed to COVID or who were diagnosed with it. It's all well and good for Maine CDC to say that you should quarantine or isolate. But what if you don't have a safe space in which to do that? What if isolation means that you don't have a way to eat? The pandemic has worsened challenges for people who were already just trying to get by, to have food and a roof over their head every single day. And that's why the next number matters, 5,766. That's the number of Mainers for whom we provided some degree of social support or community care. Mainers who needed help with quarantining or isolation or just an extra hand getting by. Mainers who reached out during a time of need and in doing so found a hand that was willing to help them. But more than anything, what has been remarkable about the pandemic is how much all of us have changed. But at the same time, how much some things have stayed the same. How much on one hand, the pandemic has been punctuated by anxiety, but also riven with boredom. We've been anxious because we don't really ever quite know in a pandemic whether things will get better or get worse. But we've also all experienced boredom because of the unbearable sameness of it all. It's almost as if March of 2020 just blurred into March of 2021 with little recollection of the year in between. I think it's a function of how little we've moved, both physically as well as metaphorically. So much of our lives, whether it's work meetings, conferences, parties, reunions, family dinners, even funerals, have all occurred in the same physical space on that same cramped screen from that same chair. And as a result of that sameness, these events are harder to process and harder to differentiate from one another. In effect, we are now all on the Zoom where it happens. And that's why the last number, or rather ratio, is critical, 1 in 8. As of this morning, 1 in every 8 Mainers had received both doses of either the Pfizer or Moderna vaccine, or a single dose of the J&J vaccine, 1 in 8. That is our road to recovery. Now, our future will be different from our recent past, but there will be a gradual resumption of not just the activities, but also the places in which they traditionally occurred. We all want to get back to the way things were before, to be not on the Zoom where it happens, but back in the room. We want that as much for the familiarity as well as for the novelty of those experiences. That is the promise of vaccination. Maine is making steady progress, and my only ask for you today is that when you are able to be vaccinated, you say yes, because that is the pathway that we will stay on to keep us back to that path toward normalcy. One final thing. There have been one group of folks who have been with us since our very, very, very first public briefings. One of them has joined us here today, and that is Dr. Reagan Thibodeau. Dr. Thibodeau has become a familiar face for all of you who have joined these briefings over the past year. We're almost at 170, if you can believe it. Dr. Thibodeau and her colleagues have not just been a face that many of us have seen, but for many hearing impaired and hearing challenged Mainers, they have also been the voice and the news that they needed to know about keeping on top of and in touch with what was going on. So Dr. Thibodeau, to you and your colleagues, we thank you for all of your partnership and your efforts over the past year. So with that, Commissioner Lambrou and I would be pleased to take any questions that our colleagues in the media have today. The first question goes to Patrick Whittle.
Thank you very much, and thank you to Dr. Thibodeau as well. So one thing I would love to know is, you mentioned that we're up to 1 in 8. Are we looking like we're likely to be able to stick with sort of the tiered month-by-month age plan the governor laid out some weeks ago? Does that look attainable at this point?
The answer, Patrick, is yes. Right now, we think that we will be able to stay with the approximations of month-by-month expansions of age tiers based on the rate at which we're vaccinating, additional folks that we're vaccinating, such as educators, childcare professionals, accounting for all of that with the recent increases in vaccine rates and deliveries that we've seen across the state day on day. We think that we'll be able to stick with that.
So everyone by end of May, as was dictated by President Biden, is realistic in the state of Maine?
Well, you know, what President Biden indicated, and I think what he and the White House were careful to indicate, was that there would be sufficient vaccine supply available toward late May. Then getting those shots into arms, that's as everyone now is aware, that's a separate process. We are doing everything that we can to increase our capacity. Indeed, just yesterday, I was corresponding with some medical leaders across Maine to let them know now is the time to start planning for even greater throughput. So we welcome the increase in supply. We're going to do everything we can to make sure we can get it into arms as quickly as possible.
Okay, great. And finally, unless I'm mistaken, I believe the clinics for teachers and school staff members over 60 are set to start tomorrow and this weekend. Are the plans there still the same, or has anything there been altered?
No, and I'll speak to that. We're really excited to have this partnership with Department of Education and, you know, roughly 25, 27 healthcare providers across the state who are working school district by school district to identify where those older, 60 and older teachers and school staff may get to go this weekend, Friday, Saturday. Some of the clinics are into next week for these opportunities for older teachers and school staff to get vaccinated. But as a reminder, all school staff and eligible childcare workers can go to Walgreens, Walmart, and Hannaford. The president has dedicated those doses towards this eligibility group. There may be some waits. It takes some time for everybody to get these appointments, but they can access vaccines there. And we're beginning to fold that eligibility group into all of our sites systems. So we are excited about those clinics, and we are also grateful to be able to open up other sites across Maine to teachers, school staff, and childcare workers.
Okay, great. Thank you so much.
Thanks, Patrick. Over to Jessica Piper at the BDN next.
Thank you, Dr. Shaw. First, I was wondering, you went over the vaccine numbers at the beginning of all this, but I was wondering if the Maine CDC has data broken out by type of vaccine or data on how many Mainers have received like at least one dose, since Johnson & Johnson's counted, I believe, in the second dose.
Sure. So the one dose is just that first dose number. that you can find on the website. That is just a Mainer who has received either the first dose of Pfizer or Moderna. Again, that's right now 293, 566. In terms of breaking it out by brand or manufacturer, we're looking at how we might be able to do that and portray that data. I can't promise that we will do so. The CDC, the US CDC, hasn't really asked states to go in that direction quite yet. But Jessica, I think it's another assumption that is fair to make, which is if vaccine is coming into the state, it's being used. So we've received around about 11,500 doses of J&J. We will receive more next week, and we move those out as soon as we understand that they are available for us to allocate. So those numbers pretty much reflect who's gotten it.
All right, thanks. And then a question probably for Commissioner Lambrou, although of course, Dr. Shaw, you can weigh in too. The federal coronavirus bill that just passed includes more money for states for vaccine distribution. And I'm wondering kind of if you could address how Maine might plan to use that.
Sure. So along with Governor Mills here at the department at Maine CDC, we are very excited about the opportunities offered to Maine with the American Rescue Plan. There is significant funding for vaccine distribution, for clinics, for other types of COVID response, as well as some of those services that Dr. Shaw previously mentioned. We'll be able to do more supports for people through Maine Care through the bill. We'll be able to extend some of our food supplement or SNAP benefits for a longer period of time, to say nothing of the extended unemployment, the child tax credits, and other critical provisions of this bill. We're hoping, I think the president might be signing that bill today to become law. I think we will certainly be giving details as we go forward. But I think in the short run, going back to what Dr. Shaw just said, all of our effort right now is focused on if that vaccine supply comes to Maine, can we get it into people's arms? So these new resources, we're hoping, along with what got passed at the end of December, will help us expand our workforce, expand our access sites, and make sure that we really can meet the challenge that is a challenge for Maine and the nation, which is getting everybody who wants to be vaccinated a vaccine as soon as possible.
Does the state have any sense of when it might start to get access to those additional funds, or?
Well, each of the different funds has sort of a different time frame for when it must be allocated to states. Some is 60 days, some is longer. So we don't actually have a precise calendar, but we're working on that. All that said, we are, again, beginning to access the funding that got passed by Congress in December. That also included $12 million, for example, for vaccine distribution, and another $77 million for Maine CDC for contact tracing and PPE and testing. So those dollars are beginning to come to the state, not quite yet, but it does take a little bit of time. So we're looking forward to accessing all those dollars as soon as possible.
All right, thank you.
Thanks, Jessica. Over to Stephen Porter.
Thank you, Dr. Shaw and Commissioner Lambrou. I wanted to ask you a question about a topic that Dr. Shaw, you raised a year ago. We're looking back a year. I know that you and your team, both of you, are likely watching COVID developments much closer in March 2020, or at least the beginning of the month, than the rest of us. And I'm wondering, can you recall the moment when you realized just how disruptive and troubling the pandemic would be here in Maine?
I can start, but I'd welcome Commissioner Lambrou's reflection as well. Stephen, it happened for me on three distinct, or there were three times. The first time was in mid-December of 2019, before Christmas, about a week and a half before Christmas, when I started, because of some work earlier in my career that I had done when living in Southeast Asia, started seeing emails on listservs of folks who were still in Asia reporting an atypical pneumonia that didn't really match with anything that was in the textbooks. And for many of us, that raised flags because we had been in Southeast Asia during another pandemic, SARS, in 2002, 2003. The second inflection point for me was on New Year's Day, or shortly thereafter, when the WHO officially notified, the Chinese government officially notified the WHO of what was happening. It was around that time, maybe a day or two after, that I huddled with my senior staff of epidemiologists and medical officers at the very table that I'm speaking to you from right now, to start saying, what do we know, what do we need to know, and what do we need to plan for? The third was on February 24th. I remember the date because it's one of those dates you remember when one of the most senior members of the US CDC, Dr. Nancy Messonnier, announced in a press conference that there were going to be significant disruptions to the way that we think about our lives for the future. And for someone with Dr. Messonnier's level of expertise to make that statement, for me, galvanized everything. So it was well before we even had our first case that we knew it was coming, and that's why we prepared.
Yep. And mine came a little bit after that, not much longer after that, when we started having our first long-term care outbreak. People probably remember Falmouth by the Sea, and it really just did take off in that particular site, showing just how contagious it is, as well as how deadly it is, I should say. That was where we had that first death in Maine, which again, we look back on that, and as Governor Mills has said, there's both sadness associated with that death, but also this interesting historical connection because the person was a descendant of a former governor of Maine who also presided in a time of an emergency. So it was that moment when we began to see just how contagious it is amongst a very vulnerable population that we knew we didn't need just to activate our Maine CDC team, but all of our long-term care teams, all of our infection control protection experts, all of our hospitals to get them ready for that potential surge of cases that came a little bit in May. But then again, another moment that was memorable was in October, end of October into November, when we started seeing that surge, unlike what we had seen previously, where we had to buckle up, buckle down, try to figure out how we tackle the spike in cases that was unlike anything we had seen before. So those were two examples of the speed with which this virus is transmitted and the incredible harm that it does inflict.
Thank you both. I wanted to ask also, revisit a topic from 2 days ago. We spoke on Tuesday about the fact that school workers and licensed childcare providers 59 and younger are eligible for vaccination sites like the one that Maine Health is operating in Sanford. But my team keeps hearing from educators who are being told they can't actually book appointments at some of these sites. They know that being eligible doesn't mean there are doses available, but some of the hurdles are more administrative than actually being related to supply constraints. For example, Maine Health told us, I think it was Tuesday evening, that it was still working through some technical issues that prevented its mass vaccination site in Sanford from actually booking appointments for these younger teachers. So what is the state doing to alleviate these administrative concerns, especially since those eligibility criteria are expected to keep expanding in the months to come?
Sure, Stephen, I can start. We too have heard many of those concerns and have received outreach from educators, licensed childcare workers who have had challenges. We've communicated those and have reminded the operators of any vaccination site in Maine that they are under the directive issued by the U.S. Department of Health and Human Services Secretary to make educators and licensed childcare workers eligible for vaccination. Now, we recognize that making that change takes a little bit of time on the IT side, but we've reminded them that this was effective upon the issuance of that directive last week. We've also communicated the same to retail pharmacies and gone one step further. The Biden administration noted that retail pharmacies should clear the lane of their appointments for teachers and educators and childcare workers. And so we too have done the same with the 3 retail pharmacies that we have partners that we have, Walmart, Hannaford's, and Walgreens. And they too were able to amend their IT systems to allow for registration. We know it's a challenge. There's no question about that. We ask that you stick with us and stick with those systems a bit longer. Keep trying. We know that they are making those changes and upgrades. It took longer than any of us would have wanted it to, but we are continuing to work with them to help them out.
Thank you.
Over to Patty White next.
Thank you, Dr. Shah. At this point in the rollout, in what groups are you most concerned about equity and vaccine distribution, whether it's race or some other factor like access to broadband or transportation? What are the groups that you're most worried about getting doses right now?
Sure, I'll start. There's 3 that our team and I meet about to talk about, think through, and keep strategizing and finding solutions for. Number 1 are Mainers for whom internet access is either unavailable or technically a challenge, that may be older Mainers, it may be those who live in rural areas. We're working on solutions, including phone-based options for folks to call and schedule that way. The second is rural Mainers generally from a vaccine availability perspective. We've talked at these meetings about some of the counties of concern that Commissioner Lambrew and I share: Oxford, Somerset, Washington County to some extent. So we're trying to dedicate and drive as much vaccine to those areas so we don't see spikes and flare-ups. And then the third, of course, are racial and ethnic minorities who have endured quite a bit throughout the pandemic, and we don't want to replicate those concerns or those disparities as we move through the vaccination phase. So we're taking deliberate steps to figure out if there is additional education, if there are town hall meetings that need to happen, as well as making access available to places that we know where there are high concentration of racial and ethnic minorities. Downtown Lewiston, for example. How can we start to bring vaccine to those places rather than ask folks who live there to move to the vaccine or go to the vaccine?
Okay, great. I have another question, but just a quick follow-up to that. In terms of the Western Maine counties, what is, I mean, you said, I think on Tuesday that, Johnson & Johnson, the lack of that vaccine has been an issue, but other than supply, I mean, in those rural counties, what else is going on? Is it transportation? Is it finding a site for clinics, or is it vaccine hesitancy?
Certainly the former two. I think that's why the transportation announcement that Commissioner Lambrew made on Tuesday to allow individuals who need a ride, not want a ride, but need a ride to a vaccination site can access one. Transportation, we know, is a challenge, not just with vaccination, but access to so many other essential services. But then the second is making sure there are sites for vaccination. We've worked a lot with healthcare providers, and I think we've made really great strides with hospitals and more recently, federally qualified health centers in Somerset, Oxford, Piscataquis, Washington counties to activate as many of the federally qualified health centers and get them vaccine. So those are the two things on top of, and you noted it, supply.
Okay,
Yeah,
thanks.
and I will add that in this week's allocation, you'll see that when we learned this morning that we were going to get the new Johnson & Johnson vaccine, we did disproportionately allocate them to our federally qualified health centers. 1,900 doses are going to those centers this coming week, in part for that reason. They are in geographically, or excuse me, they are by design in underserved communities, and we think that that's a tactic that will hopefully help address some of our disparities.
The last thing I'll mention, Patty, is with our retail pharmacy partners, we chose not just the partners, the store chains themselves, but also the locations within their network of stores. We chose those chains as well as activated specific stores in areas and counties of need. And so that was one way that we tried to make sure vaccine was as available as possible in those parts of the state.
Okay, thank you. And if I could squeeze in one other quick question. You've said before that when we have enough vaccine, you'd love for there to be clinics all over the place, from high volume sites, down to doctors' offices. And with that federal goal to have every adult vaccinated by the end of May, or at least have enough doses, do you still envision that happening, or do you think Maine's strategy is going to need to stay focused on the high volume sites?
So again, I'll start, and Commissioner, please weigh in. The high volume sites will continue to be a mainstay of our strategy. They have been able to provide thousands upon thousands of doses a day, but we know that they are not the only element of the strategy. And for many folks, for example, in the counties that we were just talking about, they may not be available. So as we get more vaccine, we look to activate other types of channels or points of access. Some of it will include office-based medical providers, other pharmacies like independent pharmacies, as many other as we can activate. The supply is what will govern that, though.
And it's partly to get at those populations that we were just discussing. We're excited that we have at this point 75% of Maine residents who are age 70 and older have gotten their first dose, which is exciting. But who are those 25%, and why haven't they gotten their doses? So I think when we get the increased supply, we look forward to that day when we can have these discussions. I think we will try to broaden these access points, recognizing that we're missing some people, and maybe having our independent practices, more sites like emergency departments, other places might help us get to some of those people that we are missing.
Thank you very much.
Thanks, Patty. Over to Chris Costa next.
Dr. Shah and Commissioner Lambrou. Wanted to talk about something, Dr. Shah, that you had kind of mentioned off the top was the speed with which we are delivering vaccine doses. Obviously, we don't have the complete data for week 13 yet, because that's this week, but it seems that we are trending in the right direction as far as first doses and the increase week to week of first doses that are being administered. When you look at those metrics, how do you feel about the vaccine rollout? And is there some optimism there? I know you would typically say you're cautiously optimistic about many things.
Optimism's just not, in a pandemic, optimism is a scary proposition, but we can't be scared all the time. So Chris, I think you heard this in my other comments. I'm optimistic overall right now. That could change, but I am generally optimistic about where we are heading, partly because of the vaccine, and in particular because of the acceleration. Chris, I know you keep track of these numbers as well, but just in the past 7 days, we have increased the number of average doses being done in our state by 49%. So, I mean, we're heading in the right direction. Right now, today, we're doing about 12,612 doses on average per day. And a week ago, just 1 week ago, we were doing about 8,440. So just in a matter of 7 days, we've accelerated the 7-day average number of shots in arms by 49%. That's acceleration. That's a good thing. We still have more to go, but I'm guarded and exceedingly cautiously optimistic for the first time in a while.
Good to hear. I know you also referenced this too, and I'm hoping, I don't know if you can get more specific, but you had mentioned also in your comments at the beginning, the large purchase of 100 million Johnson & Johnson doses. Is there any indication right now from any of your colleagues at other state levels or perhaps at the federal level about how that purchase would impact Maine and how many doses we could potentially see in the coming weeks?
Chris, I had the privilege of being on some conversations yesterday evening with some federal partners where, among other things, we talked just exactly about that. One of the questions we posed was, of that new 100 million purchase, what is the delivery timeline for that? It looks like it's a little bit further out, so it's not clear that that will be in the immediate term. Right now, the question that I posed to some of our federal partners is, for example, is Johnson & Johnson on track to meet its commitment to the US government to deliver 20 million doses throughout the balance of the month of March? So that's the question I was focused on. But as to the 100 million doses, it's welcome, and we look forward to being able to utilize it as soon as it gets within our borders.
Sure. And my last question is for Commissioner Lambrou, I think primarily. I'm wondering if you can kind of help explain where a child protective services worker falls into sort of this category between, are they considered a healthcare worker or a child care worker or none? I said neither, and why or why not?
Sure. So child care workers, child protective services workers, caseworkers, supervisors, et cetera, they are not healthcare providers. They are not healthcare professionals. They are also not childcare providers. Childcare providers are typically trained and licensed to take care of children while their parents are at work or at school or in other different circumstances. Our child protective services workers are trained to help children who may need it because of abuse or neglect. So it's a different type of work status. Governor Mills announced that she was going to phase our eligibility here in Maine based on age because of the risk associated with being older with COVID-19. President Biden did direct last week that all states and all providers of vaccine make eligible child care workers, pre-K through 12 school workers, teachers, as well as Head Start and Early Head Start. President's directive did not include child protective services workers. We hope that with the increased supply that Dr. Shah just talked about, we will be able to get to them as soon as possible. They work here at our department. They are incredibly valued members of our teams, and they do incredibly important work for the state. But until we have additional supply, we are continuing to use our plan, which is to try to get to all people in their 60s this month, as well as this newly eligible cost.
Okay, thank you, Commissioner.
Thanks, Chris. Over to Amy Brown next.
Thank you, Dr. Shaw. Can you hear me?
We can, Amy, loud and clear.
Okay. Okay, everyone's video has frozen, so I wasn't sure if my audio was still working. So I have a couple of questions from listeners. One asks, says, so I'm fully vaccinated. What kind of risks do I really face and or pose to others? And am I protected against variants?
So Amy, lots of moving pieces in that question. Without knowing exactly which vaccine and which variant and so on and so forth, and as well as what risks they're contemplating, I can't give too many specifics, but here's what I can say. In general, the vaccines, all three that we have, as I've noted, are spectacularly effective at keeping people out of the hospital and keeping them alive. And as a result, certainly someone who's vaccinated should feel free to gather in a private residence with others who are unvaccinated, and even feel free not to wear masks in that situation. But outside of that private gathering with other vaccinated folks, some degree of caution is still warranted. You're going out, you're going to the store, wearing a mask is still the right thing to do. In fact, it is the thing to do. Similarly, if you're gathering with folks who are not vaccinated, wearing a mask is still advisable. The vaccines are spectacularly effective, but nevertheless, it's still better to take precautions like doing sensible things like wearing a mask. Now, with respect to the variants, the early data that we have suggests that all three vaccines have a high degree of effectiveness against the variants that we have. They vary a little bit on the margins. Some does a little bit, one does a little better with this one, another does a little better with that one. But overall, all three vaccines provide great protection against the variants based on what we know right now.
Okay, and so once everyone who wants a vaccine has had an opportunity to get one, will the only people who are at risk at that point be the people who have not received a vaccine for whatever reason, who've chosen not to, or who can't for health reasons or whatever? So in other words, will life be able to get back to normal, even if that 70 or 80% herd immunity has not been reached for the people who've been vaccinated?
Not really. The answer really there, Amy, is no. We really need to get to that threshold. What herd immunity does, in effect, is that it provides a sufficient amount of protection even for those who have not or are unable to be vaccinated. So until we get to that level, really, that's the magic of that level of population immunity, because it means that even those who are unable to be vaccinated still get protection, are still conferred protection by virtue of everyone around them being vaccinated. So until we get to that level, we can't really say one way or the other that we'll be back to normal. We can be on that road, and that's encouraging. And there are certain things that vaccinated folks should be more at liberty to do, but that level of threshold of population immunity really is critical.
Okay, and is that primarily for the sake of the health of the people who haven't been vaccinated, or is that because of the likelihood that variants will continue to develop until herd immunity is met?
It's a little bit of both. It's a little bit of both.
Okay, and just one final quick one from someone who has been spending a lot of time wiping down counters at work. They ask, are surfaces still of concern?
The latest data, as well as the latest recommendations from the CDC, note that although surface to person transmission was a concern, a theoretical concern early in the pandemic, there have been very few, if any, cases of COVID-19 that have been documented as being acquired from someone who touched a surface and then put their hand to their face or something of that nature.
And that's a good reminder that we announced when we announced our Moving Maine Forward plan that we're updating those COVID-19 prevention checklists. And those updated checklists will include some modifications to the cleaning guidance in light of what we've learned about that. That should be coming soon.
Great, thank you.
Thanks, Amy. Over to Brian Sullivan next.
Thank you, Dr. Shaw. I wonder if as the vaccine becomes more readily available and the projected expansion to people 50 years and up becomes what the state's going to do in, say, April, would there any thought be given to including those with pre-existing conditions in that next expansion of availability?
Brian, I hear where you're coming from. At this time, we don't have any plans or any intentions to depart from the framework that we set forth, that Governor Mills set forth a couple of weeks ago.
And I guess the next question I would ask would be going off a couple of things that you mentioned, and also Commissioner Lambrou, you talked about the 100 plus or 100 or the million meals that have been delivered, and also worrying about the 25% of the elderly Mainers who have not gotten the vaccine yet. I wonder if the state has given any thought to working with the groups who would already be working with these elderly people to help shepherd them through the process of getting the vaccine in the days ahead.
We have thought of that, and we are doing it. We have been working with our area agencies on aging as well as AARP to begin this process of identifying homebound seniors who otherwise would struggle to get a vaccine. So that is a project that we've undertaken already. We are also, again, going to continue to try to figure out, are there other strategies, bringing some of those people to our sites with the transportation option we just announced, or again, bringing vaccines to those individuals. And while it is a fairly labor intensive and not efficient way to vaccinate people one by one, we want to make sure that those people do have the same opportunity that other people have. So that is a work in progress.
Is that something that perhaps funding could be used for, instead of just these agencies going it alone, any COVID funding to help them with that process?
Yes, we have been working on amending our funding for our area agencies on aging to do this work. We know that some of our healthcare providers, home health agencies, have also been able to bill the federal government and Medicare, Medicaid, and all the private insurers for this sort of service. I mean, I think we have basically said we want to make sure that funding is not the barrier to trying to get people vaccines. So when we find that is a barrier, we work to overcome it.
Thank you.
Thanks, Brian. Over to Allison Ross next.
Hi, Dr. Shaw. Thanks so much for taking my question. So just to start, could you clarify one statistic for me? Is it 1 in 8 Mainers have now been fully vaccinated, or 1 in 8 have received at least one dose?
No, 1 in 8 have been fully vaccinated. Or, sorry, Allison, I'll be even more precise. 1 in 8 Mainers has received either their second dose of Pfizer or Moderna, or their one and only dose of J&J. The reason I backed away from fully vaccinated is that fully vaccinated has a slightly different meaning, which is that you've had that 14 days of waiting after you've gotten both doses.
Right. All right. Thank you. And we've been hearing from viewers saying if they don't have a reaction like a fever or cough or chills from that second dose, does it mean that the shot wasn't as effective?
Correct. I've heard this a lot too, including from my mother. The bottom line there is that if you don't have a reaction after your first or second dose of either vaccine, don't worry about it. The vaccine is still working. If you do have a reaction, that's okay too. That doesn't tell you that you're getting more benefit or anything of that nature. The reactions happen in different people for different immunological reasons. They do not signify that you are getting the maximal or suboptimal benefit of the vaccine. What matters is that you get the shot, and that's all you need to do.
All right, good news there. And then my final question, just is there any update on the statewide website or phone line for the vaccine? I was
guessing that Brian Sullivan was going to ask me that, but since you asked, Allison, the answer is yes and no. So let me talk about the scheduling piece first, and then we can talk about the phone line. So we are making really good progress on both. We believe that we will be, I'll just say this, I think we'll have some more announcements very, very soon around both of those.
Great, thank you.
And the final question for the afternoon goes to Joe Lawler.
Yes, hi, thanks. I have one from my colleague at the Lewiston Sun Journal, and then a couple of my own. The Sun Journal would like to know about the vaccine rollout in Androscoggin County. It seems to be lower there. I know there's a mass vaccine site opening up on March 17th. But aside from that, can you explain why it's going slow there? And do you think there'll be more mass vaccination centers in Androscoggin?
So let's first start, Joe. You know, there already is vaccination that's happening at, for example, Central Maine Medical Center, as well as other medical providers across Androscoggin County. But yes, we are working to be on track to open up a larger scale site at the Auburn Mall next Wednesday. That will certainly help and try to have more throughput at that site. We also, though, recognize that Androscoggin County is a large county. It's a diverse county. There are different needs there. So we're investigating other sites across the county, as well as I mentioned in connection with Patty's question earlier, looking and thinking about ways to bring vaccines to areas of higher need, particularly in the Lewiston area.
Okay, thanks. And my second question is, do you anticipate soon any updates for visitation at nursing homes? I believe the US CDC has made some changes. Will Maine be seeing any changes soon?
Yes. Yesterday, the Centers for Medicare and Medicaid Services issued new guidance about visitation, which basically states that visitation must be allowed at all times and for all residents, regardless of vaccination status, unless there's very specific circumstances. Those circumstances include if that resident has COVID-19, that resident is in quarantine or isolation, or in the case of an unvaccinated resident who lives in a county with a high positivity rate, over 10%, there's no county in Maine right now that has a positivity rate that high, and when there's not a lot of vaccination among other residents. So it's very narrow circumstances where a nursing facility could say no. There's also rules about what happens if there's an outbreak in that facility. But we recognize the fact that the physical separation of of residents of long-term care facilities has huge consequences, be it anxiety or depression or confusion. So we are very excited to be putting out a memorandum this afternoon that incorporates this new Center for Medicare and Medicaid Services, as well as US CDC guidance that is partly enabled by the vaccination effort that has taken place in our long-term care facilities to date.
Okay, thanks for that. And can you hear me?
Yep, sure can,
Okay.
Joe.
All right. And my last question is just, you know, I've been noticing there's some schools in Maine are starting to offer more in person. And, you know, the culture of Maine schools has been that, you know, if the DOE issues a recommendation, that you follow it to a T, you know, cross all the T's, dot all the I's. But, you know, with some schools offering, you know, 4 or 5 days in person and other schools stuck at 2, saying they have to follow the DOE recommendations, there's really a lot of questions about equity. And, you know, it does occur to me that, you know, like they're breaking out measuring tapes, and, you know, if a desk is a half foot closer from a design from an architect 100 years ago, you know, that means that, you know, a student in District A goes 2 days a week versus District B going 5 days a week. So I'm wondering if there's any discussion about not even necessarily changing the rules, but just giving districts more flexibility on this topic. Thanks.
I'll start, which is, you know, there's always that, there is that element of local control, which we honor. But, you know, with respect to the issue you raised, Joe, around, say, spacing, you know, I think what's critical is that the US CDC just not long ago, gosh, about a month ago, put out their guidance around school opening or reopening, and they recommended 6 feet of distance. Ever since last summer or last fall, when schools in Maine started going back, we started at 3 feet because of recommendations that we thought were common sense and applicable from the American Academy of Pediatrics. So right at the outset, we were more prone to get kids back into the classroom because of that 3-foot recommendation. Now we're looking at and studying what the US CDC puts out. If they happen to change their guidance on the 6 foot and bring it down to anything different, we'll take a look at that. We'll study it, see how it squares in Maine. With that, and thanks, Joe. I just want to close the afternoon on the note where we started earlier, which is here we are 364 days after our first case in Maine. And there is one group and one number that I didn't note earlier, which is one of the questions that Commissioner Lambrou and I are often asked is, how is it that Maine has done well? And when you take a look at just about any metric on COVID, whether it's test positivity rates, testing volume, hospitalizations, deaths, the number of people who have suffered in severe ways, now talking more about PPE and then now vaccinations. No matter the metric, Maine is generally at the top of whatever table you're looking at. And one of the questions that is often asked is why is that? Is it our geography? What is the case? And I have an answer there that boils down to one number, which is 1,344,000. That is the number of people in Maine. And it's the number of people in Maine who I believe have taken time to understand what's going on with COVID and take steps to keep themselves and their families safe. Perhaps the most critical number of all. And so I'd like to take a moment to thank everyone in Maine for sticking with us, listening to the science underlying the decisions that we make, believing in that science, and then taking those steps to keep your family safe. We're not out of this yet. We still have a ways to go, but we are making progress. With your help, we will get there sooner than later. So with that, thank you all so much for your time this afternoon. We look forward to catching up next week. In the meantime, be kind and take care of one another. We'll talk soon.